Start. All right, so this is Claudia again. I'm doing the second video assessment, part 1. So today right now we're going to be assessing the abdomen and then your upper and lower extremities. Is that all right with you?
Yeah.
Okay, and can I get your name again, please?
My name is Gradle.
Okay, and your birthday?
December 1669.
Okay, wonderful, and that matches up with the records that we have. All right, so I'm going to perform hand hygiene and make sure that we have privacy. Okay, are you comfortable as it is?
Yes.
Yeah, okay, so we're going to start with the abdomen. So I'm going to lift up your shirt. Is that all right?
Yeah.
Okay. Yeah, perfect, thank you. Set that down a little bit. Okay, so first what I'm going to do is I'm going to inspect the abdomen. I'm looking for the color, skin color, any changes with that or abnormalities. I'm making note of all the lesions that I notice, and just looking for any noticeable bumps. If I notice sometimes on some people, especially thin people, you can see the aorta pulsation. The pulsation of the aorta on their abdomen, and that would be normal. Okay, and so I'm not seeing any abnormal findings here. The skin is soft and warm to the touch, and there's no discoloration. So I'm going to go ahead with the next part now, and that will be auscultation. So before I start, I'm making sure that my stethoscope has been wiped down. Okay, and I'm going to start in the right lower quadrant and then move clockwise. So I'm listening for gurgling sounds, kind of, and then of course if any abnormal sounds, and it should be about 5 to 30 per minute. Okay, so right lower quadrant. Okay, that's nice and vocal. Okay, I can hear quite a bit in the right upper quadrant as well. Moving on to the left upper. Okay, and to the left lower. Okay, and again, nice healthy gurgling sounds, nothing high-pitched or tinkling, which is good. Okay, and now we're going to move on to the percussion. So I'm going to just put my hand on there again and tap it. We'll go in the same order as before. And not a nice round sound, nothing too dull that would be indicative of lots of fluid buildup or a mass or anything like that. And so now I'm going to go on to the light palpation. We're not going to do deep palpation, but we'll go light. So I'll be feeling for masses and any bumps, lumps and bumps underneath the skin. Okay. And just let me know if you feel any pain, discomfort, tenderness.
Okay.
Okay, and how did that feel for you?
Good.
Okay, and there was a little bit of tightness up in the left upper quadrant, so that's where the stomach is, so we just had lunch, so and okay, I can cover you up again now, and I should have asked this before, but when was the last BM that you had?
This morning.
Okay, and have you had any trouble with bowel movements?
No.
Okay, and have you had any trouble with urination in the
No.
recently? Okay, so that's all good. Okay, then we're gonna move on to our extremities. So if you can sit up, make yourself nice and comfortable a bit. Yeah, we can continue to have the pillow under here just to relax the muscles. Okay, are you comfortable like that?
Mm-hmm.
Okay.
A little
Yeah.
bit more.
Just do what you gotta do.
Okay.
That's good too?
This is good, yeah.
Okay. So we're going to do the upper extremities first.
Okay.
Okay, so the shoulders, if you can, okay, so I'm going to inspect your arms. Sorry, can I pull this up a little bit?
Yep.
Just so I can make sure I can see. Okay, and if you can hold them out for me like this, then I'm going to inspect the shape, the size, to see if it's symmetrical, and it is. Then I'm gonna feel the skin. It's a bit cooler up here, but the skin is nice and warm. The color is good, and capillary refill is immediate and the same on both hands, which is good. So I'm going to start with the shoulders. So I'm going to palpate the joints a little bit.
Okay.
Please let me know if you feel discomfort, tenderness,
Okay.
or any pain. Okay, so. Lift up your arms a little bit, yeah. And how does that feel?
Feels good.
Okay. And so while we're at the shoulders, do you mind lifting your arms up for me all the way? Okay. And then down again. Okay. And then to the side. Up all the way. And down again all the way. Okay. How did those feel?
Feels good.
Okay. And there was no there's no crepitus at the shoulders. Okay. Then if you go up like this and up again and down. Okay. And okay. Is that all of them for that one? Abduction. 1 second. Did I get all of them for shoulders? Oh, and then we will also rotate. I know it's not the best space. Rotate. Okay. Okay, so slight crepitus. And this one, is that discomfort at all?
No, it's not discomfort.
Okay, and then we'll go backwards. Okay. Good. Thank you. And how did that feel for you?
Feels good.
Yeah, no pain.
No
on
pain.
that? Okay. Then we'll move down to the elbows. So I'm going to palpate them again. And how did that feel for you? Any pain?
No pain.
Okay. Then we're going to test again the mobility a little bit on those. Just hold them out and then up and down. Extension. Okay. Inflection and extension. Okay. And now I'm going to hold here. Can you do it against resistance? If I'm holding on over here. Okay. Now
yeah.
Try. Okay. And now up again. And you can hold it like this. And can you push against them? Okay. And that's quite easy for her. How did that feel for you?
Good.
Okay.
Mm-hmm.
Then we're going to move on to your wrists. So I'm going to palpate them first. Any tenderness there?
No.
Okay, then can you flex them and back to normal, and then other way, okay, and then can you do inversion from a little bit? Yeah, and eversion, okay. How did those feel?
Feels good.
Yeah?
Mm-hmm.
Okay, then can you up again? I'm just gonna feel it while you move. Down, yeah, even, yeah, and in. Okay, and there was no crepitus there either, and no pain?
No pain.
Okay. Then while I'm gonna do again, I'm gonna give you resistance, and then we'll see if you can. So if you hold like that, can you push against? Yeah, okay. And yeah, and now try to lift up your wrist. Okay, good. Okay, and now I'm gonna assess the fingers, the knuckles, Have you had any troubles with your knuckles or your fingers?
Not really.
You can say. Yeah. Does that hurt anywhere?
When you press down?
Yeah.
No.
On your knuckles here?
No.
Okay.
No, it doesn't hurt at all. No.
Okay. No. Okay. And can you clench your fingers really tight? Okay. And then extend. Okay. And splay them out like this as far as you can. And then together. And can you invert them a little bit at all? And then evert them if you can at all. Okay. Yeah. Good. And how do those feel for you?
Feels good.
Okay. And I'm going to, again, can you push against my hands with your fingers? Good. Okay. And that felt okay for you too?
Mm-hmm.
Okay. What am I missing? So we tested for all of those. Oh, and then, sorry, for your elbows, have them out like this again, and can you supinate them, and then pronate them again? Okay. And what else did I miss? There was one other. Oh, no. Okay, so that was it, I believe, for the upper extremities. So now we're going to do the lower extremities. Okay, so can you pull up your pants a little bit to around the knee? Thank you. Okay, and do you mind if I take off your socks?
No, I don't mind.
Okay, so first we're going to inspect them again. I'm inspecting the color, the shape, and the size for symmetry, and they seem to be very symmetric. I will look at the skin for lesions. I'm also assessing for edema. There is no noticeable edema. Okay, which is good. And now I'm going to palpate some of your pulses.
Okay.
So first I'm gonna do the patellar. Okay. So you can feel your left one right away. Okay. And I feel your right one as well. They're not very strong, so I probably rate them as +1. But they seem to be even and steady. And so now I'm gonna check the tibialis, posterior tibialis. Oh my goodness, yuck. Okay, and same thing here. I can feel them and they seem to be symmetrical, but they're not very strong. So again, I would chart them as +1. Rather weak. Okay. And for the last pulse, I'm going to check the dorsalis pedis. And these are quite strong. I would rate them as +2. Very good. And they are also even and symmetrical. Okay. And while I'm here at the feet, I'm just going to assess the feet as well. The skin, the toes, skin's a little bit dry, but otherwise there are no lesions, nothing cracked. And I'll assess the nails for any signs of fungus or cracking. And they look good. And I'll assess the bottom of the foot a bit too. And no lesions, and the skin is a nice pink color. So we're going to, I think you can put your pants down. Let's see. Okay, so now we're gonna check your joints again. I'm gonna palpate your hips a little bit. Any pain or discomfort?
No.
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 And then this is probably going to be easier if you're lying down. Sorry, make you
It's
switch
okay.
positions.
It's okay.
Okay. Now if you can lift up first your right leg. Okay. Perfect. And yeah, you can set it down. And now your left. Okay. Good. And how did that feel for you lifting them up?
It was okay.
Okay.
Yeah, it was good.
Can you do that again? I'm just going to feel your hips as you do that. Okay. Slight crepitus in the right hip,
Mm-hmm.
but it didn't hurt?
No.
Okay, so I can make a note of that. Then I'm going to, check the knee joint. So I'm checking the left knee. And I'll check underneath it a bit. And there's no edema. Did that, any tenderness?
No.
Okay. And now if you can, start with this one again. Yeah, raise it and extend it. Okay, and then flex again. So just lower the, yeah. Okay. And how does that feel?
Feels okay.
Okay, and you can lower that. And this one, yeah. One more. Okay, you can lower that again. And that one as well, your left one felt good?
Yeah.
Okay. And so then we'll move on to the ankles. So I'm gonna palpate first. Any tenderness here?
No.
Okay. We'll move on to the left one. Any tenderness that
No.
you notice?
No
Okay.
tenderness.
Then if you can dorsiflex, so bring them up towards your face. Yeah, both of them if you can. Yeah. Okay, and then plantar flex, put them down as far as you can. Okay, how did that feel?
It's good.
Okay, and then invert them. So your soles are going up a bit. Yeah, okay, like that, good. And then evert them. Okay, and it seems to be bilaterally symmetrical. How did that feel?
Feels good.
Yeah, no difficulty that you
No.
notice? Okay. Then we're going to check the toes. So you can you lift up your toes a little bit? Yeah, okay. And then down. Can you splay them out a little bit at all? Yeah, okay. And any difficulty doing that that you
No.
notice? Okay. Then now we're just going to test your muscle strength a little bit. Okay. With your hips, is this going to be easier to stand? Hold on. Can you abduct this one out? This leg out? Yeah. Okay. And abduct it again. Okay. Abduct and adduct. Okay, good. So now I'm going to give you some resistance. Can you push out? Okay, yeah, quite easily. And yeah, if you have it just out a little bit, then can you push back in? Quite easily. And we'll do the other one. Push out. Okay. And push back in. Okay, quite easily. And we're also going to, can you invert your hips a little bit? So going in, your whole leg going in a little bit.
Like
Yeah.
that.
Yeah, exactly. Okay, and you can go back out regular and out a bit. Okay, and now the other one. In, okay, and out. Do you notice any pain or difficulty with that? Okay.
It's easy.
Let's see if I got everything for that. Muscle strength. Yeah, okay. So that was it for that part. Do you have any questions about that?
No, I'm good.
Okay, wonderful. Well, then I'm gonna wash my hands. Thank you very much.
You're welcome.